Joining us now to discuss the latest in vaccine development is Dr. George Benjamin. He's Executive Director of the American Public Health Association. Dr. Benjamin, welcome back to the show. First, I need to ask you about these vaccine numbers and the returns. When people hear these numbers and they hear these drug makers getting so wealthy, making so much money during a pandemic, what is the response? What is the justification for that?
Well, they are in business, and they certainly can make some money. But I think that they're going to actually need to also try to invest in the rest of the world. They need to take some of this profit that they're going to make on these vaccines and make sure that these vaccines are available at least at cost, but hopefully free to most of the part of the world that cannot afford to get these vaccines.
How likely is it that they'll do that?
Well, they're beginning to do that. Through the COVAX coalition, they're doing that. And of course, some of the other nations, like the U.S., are actually buying these vaccines and then giving them to these nations. But it's going to be important that they be good partners and also deliver some of these vaccines for free.
Another big topic, big discussion: vaccines for children. Pfizer, Moderna announcing they'll start testing on children, I believe, as young as 5. How likely and when is it that we might see vaccines for children? How important is it, do you think?
I think it won't be till the late fall, maybe early winter here in the United States. It's going to take 6, 8, 10 months to actually do these kinds of studies. These are not only studies for safety, but they also have to figure out the right dose. So it takes a little longer. And of course, kids are not little adults, and so you have to be a little more careful with the children. But hopefully they'll be able to get something, starting in the end of the year or first part of next year, because we really need to get those young kids vaccinated as well.
Are there any indications of risks that are specific to young people?
I'm not aware of any specific risks that have been demonstrated beyond the other kinds of side effects that we have, sore shoulder, not feeling well. It is very clear, however, that most children don't get as sick with COVID, but when they do get sick, they get very, very sick. So vaccinating them is still a priority because of that.
And we're talking about obvious symptoms. Really, the data is not there yet about long-term effects, even cognitive effects. But I want to talk about booster shots and the importance of them. Some countries calling for a third shot, leading data suggesting in Israel that it might be coming up soon. In the U.S., the CDC and NIH not yet making that recommendation. Your thoughts?
Yeah, we're not there yet. I think there's, we're going to see some of that data come out because, a lot of this stuff is basically looking at lab tests and not actually looking at what's actually happening in the real world. Israel, because they have such a large percentage of their population vaccinated, we may very well see what's going on in the future. But at the end of the day, the thing that's probably going to drive these boosters more than anything else, and the need for boosters, is if we get a variant that escapes the vaccine in a substantial way. And then we're going to definitely need a booster.
And it seems we're not there yet, thankfully. Lots of people talking about possible lockdowns, shutdowns in the fall. Your projections, and can the economy handle that?
I don't think we're going to be doing lockdowns. I do think we're going to be having outbreaks, just like we see, we have these big measles outbreaks in some communities, which means we're going to be testing, contact tracing, isolating, quarantining, and vaccinating around those outbreaks when they haven't been adequately vaccinated. The real challenge in the United States is that we still have about half of our counties which have less than 40% of the community vaccinated. So we have a lot of work to do. And quite frankly, the outbreak that we're having right now, this pandemic, is pretty much isolated to those communities where people are not adequately vaccinated.
And one of the things you hear from naysayers, if the vaccines are safe, why do they not have full FDA approval yet? So what's your response?
So, pretty simple thing. It just takes a long time because they actually have to approve not just the vaccine drug itself, but they have to validate the building, the process, the whole range of things. And it just takes time because once they do it, it's very difficult for them to pull back. They can, but they like to do it in a certain way. And the normal process just takes time.
Dr. George Benjamin, thank you so much for your insight as always.
Thank you. Good to see you.